Hi everyone, you're welcome to our basic chemical pathology series. Today we are going to be dealing with biological variables that affect test results in chemical pathology. My name still remains Dr. Iya Izzy Bassi. So, what are my expectations for this session? I'm hoping that by the end of this session, you should be able to describe the biological variables that affect test results, and that you should be able to, when carrying out tests, look at these biological variables before you interpret those tests. So usually when you carry out laboratory tests, you are trying to diagnose whether there is a disease or not. And usually these laboratory tests have ranges and things like that. Once it is out of range, you know that this person is sick and all that. But you should be very, very careful, because when trying to interpret these results, you may have situations where somebody is not sick, but its results are out of the normal range. This may be that the person is not sick, but that some biological variables have affected, that result. So when carrying out a result, you must find out if those variables have been taken care of before you diagnose a person as having a result. Because there are results which on the surface may look like it's predicting disease, but may actually be caused by these biological variables. I want to show you something that is going to be very funny. They are just jokes, please. They are not for real. Everybody that is a med lab scientist is trained to interpret results. So this is just like a joke, please. So you have these two scenarios. You have this lady congratulating Mr. Simon Bitrus on being pregnant. Like, seriously, how can that even happen? How can he be pregnant? But somehow, you may have these kind of situations. For instance, there was a case where a guy is married, and his wife was pregnant, and the guy needed to do a urinalysis urinalysis test. And so he collected the urine in the container, but didn't cap it very well and kept it one side. And as the wife was cleaning up the house, the container fell down and the urine poured. And because Mr. Bitrus is very harsh, the wife couldn't actually tell him that the urine had poured. So what she did was she urinated and put inside the container and covered it and kept it where it was. So Mr. Bitrus carried the sample to the lab, and this is what came out. All right. But what did this lab scientist do wrong? He should never have congratulated Mr. Bitrus on being pregnant. He should have found out what actually happened, because this cannot be, except in very, very, very rare situation. Maybe you have a particular tumor that is producing the marker for pregnancy, and those tumors are not something to joke about. All right, the second situation is where you have this man telling this lady that your PSA results are high, we need to take out your prostate. She is a female, for God's sake. Does she even have a prostate? Only men have prostate. So what could have happened? Your guess is as good as mine. I'm thinking that probably there was a mix-up in names and samples that could have brought this out. But if you have seen that the name on the form and the gender on the form is female, why do you go ahead to, you should ask, you should even do the test. You should ask what happened and sort it out before this patient comes, because this patient looks like somebody that is going to cause trouble, for the management. All right. So what are these biological variables that can affect results? They include age, gender. Are you female? Are you male? Biologically, race. Where do you come from? Pregnancy. Are you pregnant or not? Have you eaten or not? Are you standing? Are you sitting? Are you lying down? Posture. What time did you collect that sample? Exercise, nutritional status, and then menstrual cycle in female. So you find out that even in female, at a particular point of the menstrual cycle, the results that you may have for certain markers are different from what you have at other times of the menstrual cycle. So it's very, very interesting if you know this at hand. Okay, so let's look at age. You find out that the pediatric age range differs from the adult age range, because even in neonates and babies, you will find out that it varies within the week of life. For instance, let me take a particular marker. Let me see. Okay, bilirubin. If you do bilirubin the first week of a neonate's life and the second week, there is a difference because of what is called physiological jaundice. All right. Growth hormones increase with life. Okay. Urea levels are also different. Fetal hemoglobin disappears with time to give rise to the adult type of hemoglobin. So you find out that children will have fixed levels of markers like cholesterol and haptoglobin. And if you compare them maybe with older persons, their cholesterol levels are quite lower compared to that of older persons, and they have decreased levels of immunoglobulin, especially immunoglobulin M and A, which is why if you were to carry blood group typing, for a baby, you should actually use the cells of the red blood cells of the blood from the baby to carry out your blood group typing rather than the serum, because the serum blood group kind of test uses antibodies which those children have not produced. They begin to produce antibodies of their own from 6 months onward. From 6 months downward, they depend on antibodies that come from their mother's milk, which is why breastfeeding is important. So if you look at children, we've looked at neonates, if you look at children, depending on their age, because children are growing and bones are growing so fast, you have higher levels of alkaline phosphatase levels, because the alkaline phosphatase is an enzyme that works in the bone, to accelerate formation of bone tissue. And since they are growing very fast, you could also actually have higher levels of alkaline phosphatase. And if you compare their cholesterol with the adults, they also have lower levels of cholesterol. But when people age, you will find out that their cholesterol and their triglyceride levels increase from the levels you have as child through adolescence to growing up to old age. All right. Then things like total protein and albumin levels also decrease, probably due as you're getting older, wasting sets in, malabsorption, you're not eating that much as you used to eat as a child. So many things may affect that. So another thing that can affect our test results include gender. Are you male biologically or are you female? If you look at these people that are jumping up and down, you will find out that, the man is muscular, has higher muscular mass, all right, compared to the female. So you would have the males having more hemoglobin, more urea and creatinine and uric acid. These are breakdown products that you find from muscle mass. They would have, the men will also have higher cholesterol and triglycerides. But when the women reach to menopause, their cholesterol and triglycerides become comparable. Okay, men would also have higher testosterone levels than females, which is why you have this kind of muscles. All right. For the hemoglobin, it may be higher. It will be higher because monthly women are known to lose some amount of blood, okay, and all that. Men don't. So you will have higher hemoglobin levels. Then for women, on the other hand, women will have much higher levels of estrogen and progesterone, and they will have undetectable levels of prostate-specific antigens since they don't have a prostate because they are not men, of course. So another thing important to look at when you look at lab results is race. But if you are looking at routine lab results, the effect of the race is negligible. But if you come down to genetic diseases, prevalence, incidence of certain genetic disease, you would find out that those diseases are prevalent in certain populations. For instance, your sickle cell disease is highly prevalent in people that have African ancestry. So even if the person is not of the African race and has sickle cell disease, you should know that somewhere along the line in their genetics, in their heritage, in things that there is some African blood. All right. Then people of the Mediterranean Sea kind of have a higher prevalence of thalassemia in their populations. Then pregnancy. Wow. Pregnancy is a condition. It's not a disease. But it is a condition in which a whole lot of endocrine, hematological, and biochemical changes occur. Because, during pregnancy, you have accumulation of fluid in the body, you have another child inside you coming up, taking up nutrients, using up things that you should use and all that. So you will find out that people who are pregnant will have higher levels of cholesterol and triglycerides. They will also have a higher level of liver enzymes, and specifically the alkaline phosphatase will be high in pregnancy because in pregnancy, the placenta produces a kind of alkaline phosphatase called placental alkaline phosphatase, the isoenzyme placenta alkaline phosphatase, which also would raise the alkaline phosphatase level. So you have to be careful when interpreting liver enzyme results for pregnant women, especially the alkaline phosphatase. Then they usually have lower levels of albumin, lower levels of total protein, lower levels of creatinine, urea, glucose. Though this is not hematologic, this is not chemical pathology, but also they will have lower levels of hemoglobin. Food ingestion. This is a Nigerian delicacy. It's Calabar dish. It's called fisherman soup. So when you come to Calabar, you can have some. All right. That is by the way. So question you should ask when a person comes to do certain tests like fasting blood sugar and lipid profile, you should ask the person, have you eaten or not? Because these particular markers are affected, very markedly affected, if food is ingested before you go for the test. I had a particular patient I was to collect blood from, and I was almost collecting the blood, and I'm like, did you eat? And the person said, no, I didn't eat. You told me not to eat yesterday. I said, good. But I took a little tea. Is that food? That was the end of the test for that day. I didn't collect that sample. I told the person, please come the next day for the test. So when the person came the next day, I was like, did you eat? I did not even brush my teeth. And I'm like, that's okay by me. So we're able to collect the sample for that. So these particular markers are affected by ingestion. That is why when you come for those tests, they tell you that you should fast overnight. That is after your evening meal. You should not take anything throughout the night till the next morning, usually about 8 hours, without food before you come for the test. So what posture? When you were taking the test, were you standing? Were you sitting? Were you lying down? you know, those analytes, some analytes are affected rather by changes in position like adrenaline, noradrenaline, renin, and aldosterone. So if you are taking blood for those particular markers, you have to write in the laboratory sheet whether they were sitting, standing, or lying down, supine, lying down when the blood collection was done, because the ranges are different for the different positions. Then, what time do you collect your blood sample? Some analytes are affected because of the body's biological rhythm, and those analytes will include things like cortisol. For instance, that cortisol particularly, we do have what is called 9 a.m. cortisol. We have the midnight cortisol. You know, those levels are quite different. Cortisol is a stress hormone and rises with different times of the day. So if you measure at 9 a.m., the 9 a.m. cortisol will be different from the 12 midnight cortisol. So you have to also know the time these were collected. Testosterone is another hormone that is affected by the time of the day or you collect the samples. Men are known to have their highest testosterone levels, I think, close to the morning hours, around 5 a.m. So you have those kind of high levels during that time. So you must note when you collected the sample. Then things also like fasting blood sugar. Usually, if you're collecting a sample for fasting blood sugar, it should be within 8 to 10 o'clock. After 10 o'clock, you cannot refer to that sample as a fasting blood sugar. You can't collect sample for blood sugar after 10 o'clock. It has to be between 8 and 10 o'clock. All right. Then exercise. Usually, when somebody exercises intensely before you draw the blood, you will have things like liver enzymes, your ALT, AST, your creatine kinase, and your high sensitivity C-reactive protein, which are related to muscle breakdown and inflammation being high. So usually, if somebody maybe like treks to the hospital or exerts himself before coming up for a test, the person is asked to rest for a while before his blood work is taken, because exercise affects, or you are not expected to do, you know, hard exercise before coming for those blood tests. All right, because you may have elevated levels of these markers. Then nutritional status. You can see these children, they are children. They are not sick, but they are different. You will find out that the particular parameters, like if you look at their anthropometric indices, they will be different for these different children, even though they are not sick. And if you also look at your nutrition-related markers like your proteins, your albumin, your retinol binding proteins, your prealbumin, your transferrin, your creatinine, and BUN levels, they will be different for these children. It's not that they are sick, but there is a difference in their nutritional status. You can see in Nigerian parlance, we call this one ajebota, and you call this one ajepako. So if you were to take, you know, the different parameters for these particular children, even though they are not sick, you will find out that the range for parameters measured for this child may be in the very edge of the low levels of normal, while for this child, you will have it in the high range, upper limit levels of normal. All right, so that is how nutritional status can affect results. Then menstrual cycle. Like we all know, menstrual cycle occurs in women and is accompanied by some loss of blood every month. You have hormone fluctuations, especially during the reproductive hormones, because different times of the menstrual cycle, different things occur. You have the follicular phase, which is like a growth phase. You have the menstruation phase, shedding of the epithelium and things in the womb and all that. You have the luteal phase, which is working towards release of the egg and hoping that that egg will be fertilized and form a pregnancy. all right? You have the ovulation period, release of the egg. So during all those periods of the cycle, you have fluctuations, all right? So during menstrual cycle, if you're doing a urinalysis, you have to be very careful because you may find protein and blood reported in your urinalysis. Not that the person is sick, the person is menstruating. So before you collect blood, urine samples from a female, ask them if they are menstruating or not, so that if they are menstruating, you could suspend the urinalysis until a few days after menstruation, so that if you see blood in the urine, you will know that it's not because of menses, but it's because of a particular disease, all right? Then also, if you are measuring, what do they call those things? If you are measuring fertility hormones, yes, fertility hormones in a female, there are specific days and times when those hormones should be collected, all right? For instance, if you are checking maybe the luteal phase of a menstrual cycle, you should collect your specimen on day 21 to 23, your blood specimens on day 21 to 23. But if you're checking follicular phase, you collect those particular hormones on day 3, you know, and all that. Then things like any parameter that is related to iron stores, iron levels will also be slightly changed during menstruation. We have come to the end of this session. So please, if you do have any questions, put it down in the chat. Thank you for all your support. Try as much as possible to share this video and subscribe. Thank you so much. Bye-bye. Till I see you again. Take care. Bye. Bye-bye. Thank you.